As you can see, oncology acupuncture in cancer-related insomnia. And I'm sure everyone has experienced insomnia as this guy, and you can understand what kind of effect it has on the quality of life and really on many other factors. So let's just go fast through the background. First of all, the definition. I mean, not everything is called insomnia. You have to be awake more than 3 times a night in a week for at least around 3 months, and with a daytime impact like tiredness. And there's different types. In Chinese medicine, they're very meaningful. In Western medicine, a bit less as far as the treatment. And we'll touch we'll try to see Western medicine, Chinese medicine, research versus personalized medicine. And I'll try to touch on these two major issues as we go through the presentation. So in cancer, it is very prevalent. I mean, it is really more near the 60% than 30%. And there's like three main reasons why cancer patients have more insomnia. It's to do with the tumor and symptoms related to it, and treatment factors that they are getting, and psychological issues. So obviously the tumor causes pain. Pain is one of the major reason for insomnia, but also itchiness, pruritus. Some of the medication are creating itchiness. If there is a blockage in liver gallbladder function, then it's another reason for itchiness. Some of the drugs, being itchy at night, you can't sleep. It says in the Suen, I think, that all pain and itchiness come from the heart, which is a very interesting statement. Maybe one time we'll talk about pruritus and how you treat it with acupuncture. By the way, pericard aid, but sometimes heart aid, is a very important point for it. Obviously, hot flushes, which can be also side effects of some of the anti-hormonal therapies or the other therapies. And as you can see, waking up at night to go to the toilets, nocturia, neuropathy, other pains, cough, itchiness. So everything is creating more prevalence of insomnia in this group of patients. And obviously, treatment steroids can really, for some patients, and they really don't sleep. They're on steroids, so to speak. But it's not, it's definitely a terrible feeling not to sleep. Some of the endocrine therapies and other therapies may cause different reason to disturb the sleep. And definitely, if somebody is in the hospital, it's terrible. I mean, they're really not a very good environment for sleeping. Noises, they wake you up. Actually, my father was once in the hospital, and they woke him up in the middle of the night and said, "Why do you wake me up?" He said, "Oh, you need to take a sleeping pill." But anyway, it's definitely a disruption. So psychological issues, I think all of us have been touching about it. Cancer and cancer journeys is a huge burden psychologically. It creates fears. And actually, one of the things, I just saw a patient 2 days ago, and it's kind of anxiety is actually a new concept that I got. Patients are getting a few treatment, some scans, MRI or PET CTs, and then there is an anxiety until you get the results. So you really feel anxious, but the results sometimes comes in 2 or 3 weeks later. So 2 or 3 weeks, you have sleepless night. And obviously, there's no need to expand on the psychological burden that cancer and everything around it brings to patients. And just a few words about sleep. If you don't know, sleep is seen as a cycle of 90 minutes of 4 different stages. And if you look at the wheel here, most of the cycle is actually light sleeping, especially when you doze and try to fall asleep. And it's very easy to wake you up. You know how terrible it is when you're trying to fall asleep and something wakes you up. And that's usually a short time, but it's like you're just getting to sleep. Very easy to wake up here. And then the second phase is this stable, non-rapid eye movement. Then we'll come later to the rapid eye movement. So these two phases are actually are non-rapid eye movement. So different physiological functions are happening in the body, as we know. This is a long one, actually. And then there is a shorter cycle of a very deep sleep, and then rapid eye movement with a lot of dreaming. And so this is again the kind of vivid dreamings portion. This is interesting when you look at it. Every cycle or every part of the cycle uh, is working on a different component. Sleeping is one of the best and most important things in order to create healing and recovery. And when patients sleep in the clinic, I always tell them, because they wake up and say, "Where am I?" So acupuncture has a very interesting effect on all the sleep patterns, and patients go sometimes immediately into deep sleep and REM sleep. But and I tell them, because of the healing capacity of being in a place with no time and no space, which is actually what happens when you dream. This is where healing happens. And as we see each part of the sleep, each part of the cycle helps to kind of generate healing and balance our body and mind and spirit. And this is purely Western medicine. The first part is more for the memory consolidation. The second part, the third part is more for the physical recovery, but then also for hormonal balance, especially growth hormones. And the REM sleep is very important both for emotional and memory processing. And if somebody is deprived of sleep, you can torture somebody by depriving sleep, but some people are tortured just by being sleep deprived, and therefore all her emotional and physical well-being is disrupted. And obviously this is 90 minutes, and at night you go through 4 to 6, depends how many hours you sleep. On most of the research we'll look later, there is like two validated measures, questionnaires. One is called ISI, Insomnia Severity Index, and the other one is PSQI. So this is for research and reading research. This is more for like 7 items that people can tick over past 2 weeks, and this is over for the past month. So this will be more for chronic, this is more for acute. So when we look at research, we will see that this measurement, this validated questionnaire will be used. But let's look for a moment at TCM. In TCM, sleep obviously is this movement from yang to yin. But I used to lecture to doctors, and actually when we came to differentiation diagnosis of sleep, I would ask psychiatrists to lecture and then me, and you could see how TCM gives a much broader and deeper really understanding of all the sleeping problems and all the understanding of sleep. And we have a lot of disorders in Chinese medicine. I just gave a small group of differentiation diagnosis for reason of sleeping. Obviously, there's more deficiency, excess, and I call them mixed or complicated patterns. And a lot of time we get some together. So obviously, if there is blood deficiency, yin deficiency, it cannot anchor the Shen. And this is the movement from the Shen being in the eyes and being awake to going inside and connecting into a deeper connection with the Shen, Hun, and Po. So obviously, if the liver yang is ascending, and a lot of time people will wake up like at 3 o'clock, or if there is heart and gallbladder weakness, which is sometimes overseen, but to me, actually, many cases are related to this balance between heart and gallbladder because they are balancing each other on the circadian clock, on the 24-hour clock. So you get excessive gallbladder and deficiency in the heart, or the opposite, and then a very severe and long-term insomnia. Spleen-Qi deficiency for excess, it's very easy to understand when there's heat or fire or flame or yang rising, the sleep will be disturbed. It will be difficult for the heart to anchor the Shen and for the yin to withdraw into the body. Yang Chao and Yin Chao are the main meridians that are responsible for the day and night, for this movement of the energy to the eye and to the awakening and for sleeping. They are the one also responsible for jet lag, for example. So because you get this disturbance between the yin and yang energy flowing in the world and in a person, but also in people who work night shifts all the time, or with a kind of more severe sleep disturbances. You will look into yin and yang chow and heart and kidney disharmony. And so, as you can see, Chinese medicine has a broad kind of understanding of sleep. If we look at kind of some examples and treatments that can be applied, so obviously if there's kind of difficulty of falling asleep, which is slight, can be from blood deficiency. Some women will say also around the period more difficulties if they are blood deficient, so points like spleen 10. If they easily wake up at night with thirst, this is the people who go to sleep and next to their bed there is a glass of water. So there'll be some yin deficiency. So either heart yin deficiency, then you'll do heart 6, which is extremely important point for insomnia, especially for yin deficiency. Or if you have this yang rising or too much heat in the liver, then liver 2 maybe, or GV20. And we'll look later at the points on the head. People are waking up with fear in the middle of the night, can be sometimes heart and gallbladder, especially if it's around the beginning of the night, either 11 or 3 o'clock. Then gallbladder 14, it should be, and gallbladder 41 and gallbladder 15. It's to do with this kind of upper and lower ability to close the eyes and relax. And if you look at their names, they have the same name. One is upper, one is lower. The ascending liver fire is the C point, this 4 points, Shen song on the head around GV20, and they've been used a lot in research. And they're an interesting point, especially if the dream disturbed sleep is due to liver fire and there is a lot of vivid dreams, etc. If people cannot fall asleep or wake up very early, then again we can consider the Yin Chao and the Yang Chao Mai. And very known treatment will be actually to disperse bladder 62 and tonify kidney 6. This is a very common and deep treatment for chronic insomnia, and it works because it balances the yin and yang chao, and both of them are ending in the eye or beginning in the eye. So this is a very good treatment to do whenever there's a chronic disturbance of sleep, which is more in this internal circadian rhythm. Let's look a little bit at science. There's actually a lot of science. I kind of reduced to some highlights of science, or science that we can learn from. Because to me, unfortunately, people are putting a lot of work into doing scientific work. The Western medicine is ignoring it, and a lot of the community, of our community, are not using it both to our benefit to show how effective acupuncture has been proven to be in oncology acupuncture, but also, to me, more importantly, also to learn from it. And this will be kind of a little bit in the summary of the lecture. So this study, it's for breast cancer patients who are during chemo, they have chemotherapy associated insomnia. It's a blinded RCT, so it's randomized clinical trial that are divided into two groups, like golden standard trial for Western medicine. 138 women in this trial. So it's believe me, to enroll 100, 140 people into a trial, it's a massive work. It takes usually a few years, definitely more than 1 or 2 years. So they are the 12 sessions in 6 weeks, and then 3 maintenance sessions. So twice a week at the beginning for 6 weeks, and then another maintenance session, altogether 18 weeks. So a lot of work has been done, put into the study, and again, they look at this ICI measurements validated questionnaire. The points that they used these are the points, this Shen Song, there's 4 points around do 20, do 20, do 24. So already quite a lot of points on the head. Then on the arm, pericardium 6, kidney 3, and kidney 3 and spleen 6. So you can see it to balance the kidney energy, the yin energy, but also to calm the heart and maybe even to open the yin way, plus a lot of points to reduce yang from affecting the head. They added auricular acupressure or some points also on the ear. And I find, until I read research, I would use less ear points or leave people either seeds or acupuncture small needles in there. But when I looked at research, say maybe for some patients, if it's stubborn and they don't get better, I do leave, and I find it effective. This is to me something I immediately learned from research. The conclusion is there was no difference in the ISA primary at 6 weeks, but better other things like sleep, the length of sleep, the sleeping time, the sleeping efficiency. But most importantly, and this is like a wow, is that comparing the real group, comparing to the placebo, had higher cessation of sleep meds. So 56% of the patients who were in the real group, because it was compared real to placebo, had actually stopped the sleeping medication. And sleeping medications are quite terrible because you don't have a full quality of sleep. And some of them are very addictive. So this is for acupuncture a major difference between the groups. And obviously, if we're looking at if you're taking sleep medications, you may have problems in driving a car and doing other things or feeling drowsy during the day. So just this in itself is amazing outcome from this research, very robust and not small. And if you look at the points, as I mentioned, most of the points are on the head to reduce this excess of yang. I use less points on the head, but a lot of this research did more. So sometimes I may consider adding some points if I don't get good results. I do simpler treatments with less points, but I learned from research, okay, if it's not going, maybe I should learn from research and add points. And then, especially if they're repeating themselves, like this session song, do 20, do 24, will be repeating themselves because they work on the Hun, they reduce the excess yang rising up, and they helping to calm the head. Pericard 6, as we mentioned before, to calm the Shen, but Pericard 6 is also the opening point of the Yin Wei Mai. So it has additional effect, as far as I'm concerned, on the Yin. And sleeping always is to do with Yin, with allowing to go from a yang state to a Yin state. And the kidney 3 and spleen 6, the major points to tonify Yin. And then they allow additional 4 points for the practitioners to use according to their diagnosis, and this is a good design, and this points on the ear. So this was this study. There is a huge study done especially with Butterfield acupuncture. And again, this one was 360 patients. There is another one with 550. So they're very large studies with different arms, comparing like here the effect of electroacupuncture to this auricular Butterfield acupuncture that I'll talk in a minute. And it was mainly focused on pain, but the secondary outcome in some of the following up and also in some of the major research was also sleep, because if you reduce pain, you enhance sleep. And later we can even look at different mechanism of action, how it is doing that. This article, by the way, was published in JAMA. I mean, if you have a publication in JAMA, it's like, wow. And we have some good acupuncture articles on oncology, acupuncture specifically, in the most prominent journals. So we should use them to our effect, and this will be again in the end. This is this auricular Butterfield acupuncture points. It's 5 standards point. You can find them anywhere. And a lot of time they used it with this ASP semi-permanent needle and giving even the patient this or using this lower part that has magnet to stimulate the point. And the point will be sometimes left in for quite a while. But specifically with this Butterfield acupuncture, showed extremely good effect in the battlefield for soldiers, but also for patients with chronic pain. And unfortunately, chronic pain can be a major factor in cancer and a major factor in producing insomnia. So it's interesting to remember these points, either do this protocol or use some of it. As I say for myself, I'm more a purist. I less use ear acupuncture, but for pain, I'll use ear acupuncture. I was very convinced by research and then by clinical practice. And another trial, and I'm trying to show this larger ones, the 268 participant. It's very, very interesting. This is a kind of shoot off from this first trial of Butterfield acupuncture, but also trials to comparing electroacupuncture to auricular. They both improved this scale, but what was interesting in this trial that the benefit, because this was 10 weeks of treatments, but the benefits were persisted also 24 weeks later. So 6 months later, after these 10 treatments, there is still benefit for the acupuncture for insomnia. And sometimes patients ask me, how long will the effect of the treatment last? Because they're hoping it's not for a day or two. And definitely you can say, if you look at research and different oncology acupuncture research shows benefits after 6 months and after a year for hot flashes, and here we see this benefit for sleep. So this is and it was published in Cancer quite recently. So this is a kind of major convincing points to have oncology acupuncture for all cancer patients. Definitely, it's better than giving the medication for many reasons. So that should be the first line of practice. And if this fails, then okay, take a sleeping pill. And there is different ways to explain the mechanism of action now, and acupuncture is kind of very rigorously been studied because there's like, how come this small needling in these different points in the body producing such a great effects, and also in animals. And we know now different mechanism of actions through different pathways, neurological pathways and others. I will not go into them, but it's good to know that there have been exploring pathways, and especially from a Western medicine perspective, the question how it works, what's the mechanism, is as strong as if it works. So I was surprised to find out how important it is for the Western medical establishment also to understand mechanism. Even if you have slight mechanism, it's better than none. Otherwise, we are still seen as an alternative doing strengthening. If you have a mechanism of action, you immediately moved into this realms of looking at your practice and what you practice as medicine. And that's what we do. We do medicine. And we excel in our medicine because we can refine our ability to diagnose, especially in insomnia, to understand the patient much, much better than Western medicine can understand the different sleeping patterns. So I think we should be proud and apply our medicine definitely for this condition, especially looking at all this research which is came up. This is a very recent research just published this year. And acupuncture, it was a systemic acupuncture for systemic therapy associated with insomnia in patients with breast cancers. This is a systemic review and meta-analysis of RCTs. And there is actually other one. I'm just showing this because this one had points. The other one was more showing the effectiveness. So again, when you have a systemic reviews, you're on the top of the pyramid of evidence base. after this, it's almost in Western medicine, evidence-based medicine, it should apply it for patients. And what was interesting here, and this should be discussed longer, because they took different RCTs, different randomized clinical trials, and each one were using a little bit different points. And which is good, but this is also one of the drawback when we are trying to put the circle of Chinese medicine into the box, the square box of Western medicine proof, Um, but they looked also at the commonly reported points, and I'm highlighting them because I think this is what we can also learn. And if different articles used actually interesting points, different choice of points. But one of the conclusion from this meta-analysis was there is no a single set of points, or it was very heterogenic. The different points still affect sleep, of course, because there's different sleeping pattern, but also we have to look deeper at the design of each study. Obviously, if you give the same pill for everybody, it's easy, and Western medicine followed this idea. In acupuncture, we can check not just the points, but also the system. So here we are looking at a system which is very effective, and we are looking at points which are commonly coming up at different research protocols. So again, we see this Shen Song points, do 20, and then pericard 6, spleen 6 as a kind of common protocols. I would more refine them, as I said, with the points we emphasized at the beginning of the lecture, but it's a good set to remember, and sometimes it can be the most useful one. And I call sometimes you need something, what do you do when you don't know what to do? I have a nice lecture about it. And sometimes the set of points that are repeating in research and are showing efficacy will be a good choice. Obviously, a lot of the time we hope we know what we do, but as practitioners of every medicine, many times we want to resort to something safe or something that has been proven in many different clinics and research. And research just is a research. It's just give us an objective view on a certain intervention. So the conclusion of this study was that, again, active acupuncture proved total sleep time, sleep efficacy. It showed the effect on the scoring systems, but it also affected anxiety. And as we know, it's when we treat with acupuncture, we have a larger effect on people, and definitely on their Shen, on their mind, and their ability to be back themselves. And in all the different lectures that you heard today, I think this was a common thing that patients are reporting, I'm back myself. And to me, this is like, when I hear it in the clinic, I think the most fulfilled. Because I think we do something that really it's so difficult and so unique to our medicine, and so difficult to achieve with other methods. And it happens within 20 minutes, this magic of somebody coming totally disruptive, totally in fear, totally not being able to connect to self, and then opening the eyes and say, wow, I'm back myself. My Shen is connected again to me and to my heart. And this is the effect, and the deepest effect of acupuncture. Definitely, when we want to treat sleep, we are working on this trajectory. Um, so this is the conclusion from this meta-analysis. And the last point I want to make is, let's look at comparing the TCM, personalized medicine, to RCT, or to clinical trials, to show the advantage of each one of them. And I think we live now in the world that, both are right. There's no right and wrong. And when we see it, we can enjoy from both. We can enjoy from our knowledge of the TCM and what we practice, and we can enjoy and understand, and maybe even contribute to research and evidence base. So obviously TCM, a personalized treatment, that they are individualized. So they capture the complexity of the uniqueness of the patient. And this is it, I mean, there's nothing more to say. Nobody wants to be a number. And patients, especially, they want to be treated individually. And when we look at patients, they're so different. And they're coming with such a different complaint. And when we do personalized treatment, we are addressing this complexity and we are addressing this uniqueness of them and the uniqueness of them at that moment. It's, to me, the beauty of acupuncture. We can be flexible because we can shift the focus. If one condition is getting better and other worse, they come with suddenly something else, which is side effects from the medication they took or from. So we can always kind of be flexible and adjust the treatment to the needs of the patient. If we are with fixed points, obviously it's always the same points. Maybe today the patients come with a lot of anxiety, the next day with nausea or pain. If we are with the fixed points, obviously this cannot be addressed, and you need to be a high quality practitioner in order to be flexible. A lot of time routine or fixed points will be done either under research condition or with people who just, we call it cookbook acupuncture. They just know this point for this condition. And to me, it's not acupuncture. So this personalized medicine bring us the flexibility and also the broader therapeutic scope. Obviously, if there is heat, we can advise on herbs to reduce the heat, lifestyle. We can go deeper and understand the Shen level, and we can give diet. We can give advice on which kind of exercise to do, what to do, because it's all based on diagnosis. And personalized medicine is based on personalized precision diagnosis. And this is Chinese medicine. What Western medicine is now trying to do, it is inbuilt with our system. And obviously patient engagement. When you're personalized, the patient feel more seen and understood. And this is the key. It's terrible to be in a hospital and it's terrible to be treated non-personalized. And when you can engage patients in their healing process, then healing starts. So personalized medicine allows this personalized engagement, personalized diagnosis, and all it entails. On the other hand, if we look at research and evidence-based medicine, it also has a value. I'm highlighting just few points. So first of all, it's the validation. And once you have the validation, also you learn what is inclusion, what is exclusion criteria, which type of people we can help more and which less. And when you're looking at groups, you start to identify. You can build guidelines. Guidelines can, and I'll talk a minute later about guidelines, they can be later understood and encouraged to be part of Western medicine protocols, part of insurance reimbursement, etc., and part of international sharing and sharing within our community and understanding how we can address also sometimes through guidelines because they work the best. I'll give a simple example. For neuropathy, you need to treat twice a week for sometimes in order to see results. For hot blood pressure, hot flashes maybe once a week for 5 to 6 treatment and you already see results. So, and this is guidelines that are coming out from research. Integration in the hospital, definitely evidence-based is what is needed. And it's not just evidence, it's also your character. If you can be persuasive or you have patients who are guiding you in or medical profession who see your effect on patients, it's also helpful. But on a larger scale, in the integration comes, and the recognition is coming from the evidence. Luckily, we have a lot of evidence and very strong evidence, and we should use it. And what is most important, and we are missing as and to me, it is a calling and a pain, and I'm trying to do something about it, is the translation, the evidence into practice, disseminating the science. Western medicine is built on learning from science. There is the science there and the practice here, and there's a big gap. And there's hardly dissemination, but on the other hand, a lot of science that we can learn from. So combining the science of medicine with the art of healing is one of the, I think, ideal or good approaches, and definitely in oncology acupuncture. And to this end, you are the first one to hear. I'm kind of the pre-launch announcement. The two colleagues of mine, Mark Bovy and Noah Samuels, we together worked for me and Noah for maybe 6, 7 years, with Mark for in the last 2 years, on a book which is evidence-based oncology acupuncture, which I hope will help to be also as a guideline. It covers 30 key clinical conditions, and it's backed with over 800 kind of peer-reviewed publication. It's extremely practical for acupuncturists, but also very scientific for a medical profession, and very impressive also, I think, for anyone in Western medicine to look into it. And I will not go too much into the book, but just give an example. So let's say we'll look about aromatase inhibitors induce arthralgia. It was a Western explanation, very concise and short. Everything was done in a way that it will be very appealing to both clinician. Nobody reads now long books, so we are trying to really make it into effective tool that can be enjoyable, and you immediately can see the information that you need. And when we're covering certain research, we even showing the points, explaining, and then the TCM diagnosis and the points that can be utilized and learn from research on one hand, because it's an evidence-based oncology acupuncture, but how we can enhance the research. So I hope that there's no insomnia. I hope you are all awake still. I mean, I know we are all in different time zones. And I'm wishing you all the best of health. And thank you for joining this lecture. Thank you for joining this symposium. There was a lot of in it. It was very full with information, and I hope you got a lot out of it. And from Shen to Shen, all the best and healing blessings.